Well, good morning, good morning, good morning, everybody. We have made it to Friday. Woo! Almost thought we wouldn't get here, but I tell you what, this week went by fast. Did it go by fast for you guys? Hello, Walking Dead. Hello, Nene. Izzy's in the hizzy. Hello, Izzy. Nicey Marie has made it in. Sharon, how's the garden? DT Driver's here. OJ is actually in DT Driver's recliner watching the Today Show. OJ's getting caught up on all the hot topics in America. Hello, Corey. Hey, Wendy. How's the stairwell, my friend? Our friend Angel P's in. Angel P, can you take the link today? Still said Brooks, go with your funky self. That's right. Call me Prince. Hello, Aries. Hello, A Wolf. Peach State Mama's in the house. Sue's here. Inch High, what's up, Raven? Hopefully I didn't miss anybody. If not, I'll catch you in the comments. Nucky said it really did fly by. Carly with an eye has made it in. Hello, my girlfriend. What's up, Colette? Missed you, Colette. Where you been? Nana Bananas meeting Wendy in the stairwell. What to do? What to do? Woo! This is getting crazier and crazier. Hello, True Crime Beat. I cannot believe the nerve of Miss Alexi. Her mama, well, Colonel Sanders, the defense attorney, he's doing what he gets paid for. And that is basically to just convince one on the jury that there was some sort of negligence at the hospital. A couple weeks ago, I did a show about Leilani Simon, and I was going off about the soullessness of her defense team. That is obviously worse than this. I will say this. I'm using the word this a little too much today. They do not care if the doctors lose their license, the nurses, they don't care about any of those things as long as Alexi's ass is saved. Nobody in that hospital advised her to wrap her son in a plastic bag and put him face down into a trash can. No one did that. No one. And it's one thing if one medical professional at the hospital is a little off their game. Let's say they're overwhelmed with patients and they have a lot going on. But we're supposed to believe, according to Colonel Sanders and Alexi, that everybody at that hospital was negligent. Every doctor on staff, basically everybody but the housekeeper. I'm waiting for them to file a countersuit on behalf of the housekeeper. I would love for boyfriend to sue a wrongful death suit considering his son was placed in a trash can. They have a lot of explaining to do. Exactly why did she not pull the help cord? Why did she cover up having a child? And my biggest question, I'm asking all of you in here, if you left the hospital in January without your baby because your baby was deceased, would you wait? See, January, February, March, April, May, June, July. Would you wait 6 months to file a malpractice suit, or would you do it ASAP? Does anyone find it to be a little suspus that they filed this malpractice suit after Alexi was charged with murder? I find that very, very odd. Well, I don't find it odd at all. This is all to throw off the murder charge. No parent in their right mind or grandparent would wait 6 months to file a wrongful death suit when their baby was killed at the hospital. The only reason they are doing this is because she was charged with first-degree murder. And I hope Colonel Sanders is ready, because malpractice attorneys, whether they're suing the doctor or defending the doctor, are hardcore. They're there to win. And it's not so much about the doctors. No, no, no. It's not so much about the hospital or the nurses. It's about the insurance company. The insurance company does not want to pay out those millions and millions of dollars. So they are going to fight tooth and nail to make sure this lawsuit is thrown right out the window. Tiffany is coming in with good points. She said, the case was screwed for you, Alexi, when you told the hospital you were on your period and that you were a virgin. Yes. Yes. Kaleidohope said, Brooks, the creator, found a glitch in the hospital video that shows the cleaning lady and then automatically the garbage can is behind her. I don't know what that's all about, but the baby shouldn't have been in the garbage can, period. Shouldn't have been the garbage can, period. And I understand things are getting twisted and twisted and twisted, and I'm seeing some comments, not from you guys, saying it's the hospital's fault. Matter of fact, let's get to some comments, then we're going to get to the show. I'm glad everybody is here. Kristen Williams says, this is a long one, but it applies. The way she went back to a normal life, going to prom, etc., it's unbelievable. I can't see that going over well with a jury. Me either. Let's pretend for 1 second that her version of events is true. You'd think she'd be traumatized, full of remorse. Not that I could ever imagine something like that, but just pretending I'd be hysterical from the moment it happened. I'd need sedation and serious psychiatric help. Think about that. You go to the hospital, you come out without your baby that has been in your belly for 9 months. And yes, her baby had been in her belly for 9 months. You would be hysterical. How's my baby? Oh my God. Is my baby okay? No, she said, it wasn't breathing. Well, it's not an it. It's a baby. MB Gal said, replay crew here. Love your lives. Love you, MB. But I never get to be in chat. This is a good reminder, well, for me, that a lot of people catch the show on the replay, and thank you for being here, and please leave a comment. She said, I just wanted to say that the umbilical cord is the key here. She cut it somehow, so she physically separated the baby from her. That shows she knew what was going on, and she just got rid of her son the only way she could in that bathroom. Think about that. Think about that. Whether she used her teeth, or she ripped it, or she used the, I don't know, on the paper towel machine where it's serrated. Whatever. She had to physically remove, after giving birth, separate her son from her. And it's all going to come out in trial, and we're going to watch it. Stephanie Weber has a great point. She said, if there is E. coli, I think there's a good chance her water broke early on. So true. They have mentioned E. coli was one of the problems, along with COVID and all this other stuff. A friend of mine, her water broke, and she waited a very long time to go to the hospital. They had to put her on antibiotics. The baby, Stephanie goes on to say, for sanitary reasons, I just vaguely remember my doctor telling me when he broke my water, because he was explaining the odds of it ending up a C-section for different reasons. She said, with rupture of membranes, the clock of infection starts to tick. From this point on, isolation and protection of the fetus from external microorganisms virtually ceases. Fetal mortality, largely due to infection, increases from the time of rupture of membranes to the onset of labor. We don't know when her water broke, but I have a feeling it was way before she got to that hospital. And she knows enough about her anatomy to know where that gush of water came from. You cannot tell me that old Alexi thought that gush of water came from her taint. She knew where it came from. Margaret said the boyfriend probably didn't want the baby and the responsibility. Right on, because he has not cooperated with the investigation as of what we know right now. And he was a smiling bastard at the prom, was he not? Don't think he didn't get any nookie that night. Patty Cake says, I blame the school first and foremost. They knew she was pregnant and did nothing. Now, this is where I'm really torn, because my question is, what exactly can the school do? You see, it's not a crime to be pregnant. Spoke to a friend of mine who's a teacher. Now, mind you, this is in Oklahoma. And she said at 19, there really isn't anything they can do. Child Protective Services can't intervene because Alexi's an adult. She said more than likely a counselor pulled her to the side and asked her, what she's doing about prenatal care, explained WIC, told her she needs to probably get on that. She said, and honestly, Lexi probably lied and said she wasn't pregnant. So I don't see how the school could be to blame in this one. I just don't see it. But that's just me. I have a feeling Christina is smelling what I'm stepping in. She said, oh my God, you cannot blame the school. Geez, no. No. Unless Principal Anderson is the daddy, you can't blame the school. And we know because, her mom said her boyfriend would be the father. She didn't seem to be too surprised they were having sex, was she? Amy in Boston made it in. She said, hey, fam. Before we get to this absurdity, let's take a second and tell everybody TGIF. Welcome your neighbor. Welcome, welcome. Fun fact, you may not know this about me. I'm not ashamed of it at all because I have an amazing, amazing son. He's 30 years old now. He's in the Air Force. Couldn't imagine him not being on this planet. I got pregnant with my son when I was a senior in high school. It was obvious I was pregnant. Nobody pulled me to the side, and I was 17. Now, this was many years ago. So, no. It's not a crime to be pregnant. It's not a crime to be pregnant. Thank you, Crime Traveler. She said, Henry Dinkins' trial is starting this morning. I'm going to have to catch up on that. PJ said, this story is wild. You damn right it is. You are damn right it is. Okay, let's get to it. They are claiming that the nurse killed the newborn. Now, guys, I am so furious about this, and I'm going to tell you why. I have a very good friend who is a nurse, Angel P. My daughter-in-law is a nurse, and let me tell you, she has a hard time being a nurse because sometimes these nurses are just like, screw this, and they walk out. Well, this is one of the reasons. You see, they have to carry malpractice insurance too. So when someone accuses them of killing the baby, there was no nurse in that bathroom. There was no nurse in that bathroom. And this morphine BS is a joke. They give you morphine when you're in labor. They give you Demerol. They give you whatever. Not everybody walks in and immediately gets an epidural. So they have to give you what they can to, take the edge off. So right now what we're doing is we're just throwing shit at the wall to see what will stick. I have the utmost respect for our medical professionals. And when I see something like this to try to cover up the murder of a baby, it pisses me off. Let's get through this together. Take a deep breath. Let's take a deep breath.
I'm sorry about this, but in terms of delivering a baby and it looked like you tried to hide it, we do have to have the police involved.
And that thing was crying. It came out with that thing.
I know. But the baby's going to have to be taken for autopsy and there'll be an investigator and everything.
I love how Rosa looks away as if, oh shit, the baby has to be taken for an autopsy. They did do an autopsy. Yeah. T. Wood, thank you for this comment. This is exactly why we can't afford health care in America now. It's all bullshit because of these damn frivolous lawsuits. Good morning, Angel P. How is your blood pressure?
Good morning. Luckily, I've already taken my medicine this morning, so it's holding steady. Yeah, this makes me very angry. Very angry.
You know how many of our nurses, now doctors, obviously it's a little different, are just like, I can't do this. This could bankrupt me.
Absolutely. Nobody goes into nursing to harm someone or um, to do something to, have a negative effect on the patient. Generally speaking, most nurses are good hearted and try their very best to do what they need to do for their patients. And you've got patients and family and doctors to deal with. And things like this are what make there's a nursing shortage. There's been a nursing shortage for years. Most of the nurses that are currently active are about my age, and I'll be 60, and they're going to retire out of the system. Then the COVID made a lot of nurses walk out the door, such as me. Um, and then you get all this grief from a patient, put your total career and your livelihood at stake over some selfish little child like this, or girl, lady. It's very infuriating.
Oh, look at what Marguerite said. She's a grown ass woman. Yes, 19 is grown ass. She knows right from wrong. She knows babies don't go in the trash can. She knows that. I hope she's not rewarded for what she did.
No. Absolutely not.
Bonafide said, when is her court date? I do not know. It has not been announced. Please cover it. Oh, don't think we're letting this one go.
Please, yes.
Pause to you, Anne Marie. She said, I've been an RN for 33 years. I'm 61 and I'm exhausted.
Bless your heart, Anna Marie.
They have such a shortage in San Antonio right now that they're offering nurses a $10,000 sign-on bonus. Now, you have to work there for a while to get it.
Yes.
They don't cut you.
Go ahead.
Oh, no, go ahead.
Oh, yeah. Normally, when you sign a onboarding contract like that, you have to stay there at least a year. Sometimes it's 2 years. But, nurses, I'm not trying to be a martyr for nurses or claim to know everything, but, guys, we have about twice as many patients assigned to us as we should, which automatically raises a red flag on safety. We don't eat lunch. We don't hardly ever take breaks. And I used to get bladder infections because I wouldn't even go to the bathroom. I was so busy. So it's all very infuriating.
I'm putting a poll up.
Okay.
Well, thank you, Tarnia. Thank you, Tarnia. California is gifting memberships. Thank you, honey buns.
Oh, wow.
It's
Thanks.
absolutely ridiculous that they would pull this. When I heard the one nurse, and we're going to get to it again, bona fide, thank you so much. But when the nurse said she didn't even give me a chance to save the baby.
Yes. That was that charge nurse. Yes, ma'am. That was that male nurse. Uh-huh.
Oh, that broke my heart.
Yes.
Months after Alexi Treviso is charged with murdering her newborn baby, her lawyer says nurses who treated her at the hospital are actually responsible for the baby's death. Welcome to Law and Crime Sidebar Podcast. I'm Anjanette Levy. The story of Alexi Treviso is incredibly disturbing. The 19-year-old high school senior gave birth to her son in January in the bathroom of a hospital emergency room. Police say she suffocated the newborn and then hid his body in a trash can underneath a trash bag. Now her lawyer says the nurses and doctors treating her at the hospital actually caused a stillbirth by giving her drugs such as morphine after she complained of back pain, but denied that she could be pregnant. Her lawyer, Gary Mitchell, told thedailymail.com that he has filed a notice of intent to sue the hospital, claiming Treviso was given a number of drugs that caused the baby to stop breathing. This is what Gary Mitchell told Law and Crime in an interview recently.
She had worked out that day on the cheer team for almost 4 hours, or a little over 4 hours.
Let's start with this, my friend. You're the medical professional, not me, and I want to celebrate all of you. I'm going to look at this comment right now. Nucky said, I was an LPN, and as soon as my husband graduated from pharmacy school, I quit my job. I was over a memory unit and over 35 patients, emotionally, mentally, and physically drained.
Bless your heart, Nikki. I'm so sorry, honey. And I totally understand.
So Alexi was at cheerleading practice for 4 hours. How do we know her water didn't break in the gym bathroom?
That's right.
And we know she was pregnant. We 100% sure know. Here's one picture, and this was from November of 2022. We've seen pictures of her at cheerleading. She was obviously pregnant. But Colonel Sanders, is he next going to file a suit against the cheerleading association or the school?
Yeah. What I was thinking, if something had happened to her cheering, oh boy, then we'd have a whole nother mess. Can't you just imagine?
I'm surprised they didn't go there. He's biting off a lot with this hospital. He's biting off a lot.
Yes.
From 2:30 to 7, and then was dehydrated from that. So trying to get a UA was a bit difficult, but when you do a blood test, which they took, it will also tell you whether or not you're pregnant. And it did. And that happened at 50 minutes after midnight. And she went to the hospital thinking that she was suffering from low back pain and severe abdominal pain.
Is he not contradicting himself? She was dehydrated from this cheerleading workout. She had, issues giving them urine. She was probably doing that on purpose, if we know our girl Lex. And
Right.
at 15 minutes after midnight, they knew she was pregnant from the urinalysis. So because they didn't go immediately and tell her it was okay for her to go to the bathroom, not pull the cord and put the baby in the trash. Help me with this, Angel.
Well, when you go into a doctor's office, like when you go have a test done, you can call the office and try to talk to the nurse and find out your results. But a lot of the times the doctor wants to be the one that tells you. Same thing in the emergency room. It would have been the doctor's place to go in there and tell the patient that they found out that she was pregnant. Now, I don't think that happened until after she'd already been in the bathroom. But I'm just saying, in no way that I can think of would myself as a nurse ever thought that this little girl is going to jump up, run down to the bathroom, and do what she did. I mean, people just don't think like that. I mean, you can instruct people, don't get up out of bed without assistance, as I talked about before. You can say, and her mom was in there. You know, a lot of times when there's a family member in the room, they help people go to the bathroom. As long as they've got everything charted really, really good, which I'm praying that they do, and I'm saying that I think they probably did because they knew when she came in that there was something suspicious going on. I think they've got probably their documentation will speak for itself.
100%. And anytime I've been in the hospital, I mean, I'm like, I'm going to get up, I'm going to go to the bathroom. And they're like, okay, do you need help? No, I'm okay. They want you to get up and move around. They don't want you laying in that bed. At least they didn't with me. Because let me tell you, if they could have picked me up and carried me to the toilet, I'd been all for it because I'm lazy like that.
Exactly. And somebody comes in complaining of back pain, they have their mother with them. They kind of are acting like they're very guarded in their behavior. They don't want to change into a gown, which she didn't do until after she was getting ready to go for transfer. You know, like we talked about before, people can refuse those things. Absolutely can refuse those things. And you can't tell me that when that girl went to the bathroom and a human baby came out of her, that she didn't know what that was. Give me a break. I mean, that's pretty stupid.
Mm-hmm. Oh, Snazzy's got to go. What you got going on, Snazzy? We'll miss you, Snazzy. Have a good weekend, hon. I just think it's ridiculous.
Well,
like,
the
defense attorney is doing what he's paid to do, and I have a feeling he's being paid handsomely. I just do not see how this malpractice suit, they haven't dropped the murder charges.
He's trying to focus on that morphine, I think. I don't know, primarily, and then a combination of things. But again, if they said patient instructed to call for assistance if needed, mom at the bedside, you know, a girl comes in with back pain, you're not going to say to a 19-year-old girl with back pain, don't you dare get up out of that bed. I mean, that's just not something that you would say to anybody.
Momo has a question. Didn't she refuse to have a physical examination too? Yes, and at 19, she can.
Yep. So if you're not putting all your cards on the table, you know, you're trying to turn around and blame people for not showing your cards. Well, I think they were onto her. They knew she was being guarded and suspicious. I mean, why do you go to a hospital and then refuse anybody to help you? I mean, she obviously only wanted, I don't know what she wanted. And I kind of go down a rabbit hole with that sometimes, but she was there to get help. I don't know what kind of help she thought she was getting or what she thought was going to happen, you know. But in no one's mind would anyone have ever thought, oh, this girl's going to fake a pregnancy and or this girl's going to run down to the bathroom and have this baby and, you know, rip it apart with her teeth and wrap it up in plastic. Who would think such things? Nobody's going to think that. And I think they probably charted that she was guarded, that she refused a physical exam. You know, she refused a pelvic exam. So all they did was.
And it's like a game of chicken with her mom. Her mom's like, we're going to go to the hospital. We're going to go to the hospital. No, no, no. Had she had it at home, that baby would have been buried in the backyard.
Yes.
Finally, she was like, okay, fine, I'll go. And she was at a safe haven hospital, which I think they all are. She could have pulled that cord, handed the baby over, jumped in the bed, and said, I'm ready to go home.
Well, I think it's on the same video that we're reviewing. There's going to be another man come on and speak here in a minute. And I agree with everything he said. And I'm not going to say it exactly as great as he did. But he said her behavior in the bathroom, you know, by doing what she did, putting the baby in the garbage, wrapping it up in plastic, shows consciousness of guilt because she's trying to hide something.
I love that term, consciousness of guilt. I'm going to write that down. Thank you, Angel.
And went there and indicated on a pain scale of 1 to 10 that she was at a 10. But not a single one of them told her that she was pregnant. Not a single one of them told her that we need to examine you. This is a classic instance. The female feels the need to go to the restroom. Maybe we better check and make sure she's not delivering a baby. I mean, you just don't allow that kind of thing if you know what you're doing. They did, and they didn't bother to tell her. And the child, we know, had morphine in the system. It only got that morphine because the hospital gave it to them. And the hospital didn't stop the medication after they learned that she was pregnant. They didn't take the IV out then. They waited 48 minutes.
They took it out because she went to the bathroom. And let me tell you what, any woman in active labor, the minute they go to turn down the pain medication, they're like, no, turn it up.
That's right.
Come on. They waited 48 minutes because she was going to the damn bathroom. Colonel Sanders. This is all I see when he talks.
Me too.
As tasty and delicious as it ever was. I'm Colonel Sanders. And I'm back, America. I'm back, America. It's still finger licking good.
Finger looking good.
That's hilarious.
And continued to give her not only morphine, but sodium chloride, that's salt. That's not unusual, and that should be.
Oh my.
Cadillac, Zofran.
Okay, Zofran. Let's talk about that.
Zofran is for nausea.
Okay.
It's the newer medicine. It's better than Phenergan. Guess what? It doesn't cause drowsiness. Okay, go on, Colonel.
Colonel, I know. You can't unsee it. All right, sodium chloride.
That's in an IV. My God, that is really reaching for something right there. That's an IV. That's ridiculous.
And morphine. So this is a situation in which the hospital.
Now, I don't know if you ever worked, in the OB unit, but is morphine not common to give to people in labor?
Morphine is not only common to give to people in labor, but it's also commonly given, and a lot of people will not know this, to babies in NICU. Now, a baby in NICU. Now, they can have 10 micrograms per kilogram per hour. And what we're going to hear in this video is that the amount that was found in the infant system was so minute, scientifically and medically, that there's no way that it could have affected what happened to that baby. That's just reaching for a straw.
Reaching. I don't think he understands. Maybe he's had too many buttermilk biscuits and coleslaw. Maybe his gravy hasn't been done all the way. I don't think he understands these malpractice attorneys are going to rip his old ass like a KFC chicken.
Yes, because it reeks of desperation. All of his reasonings, they just reek of desperate reaching for straws. It's not even based on logical medical standards.
Who failed her? The nurses and doctors failed her. The office of the medical investigator has failed her.
I've reached out to Gary Mitchell for a comment. At the time of this recording, he has not yet responded. Surveillance video showed Treviso going to the bathroom in a hallway in a hurry while placing her hand at her rear end. Take a look at what a supervising nurse told police about what they found when they unlocked the bathroom door.
We did a pregnancy test on her, showed positive. She was denying that she had sex. Then she said she had to go to the bathroom. She went to the bathroom. She was in there for quite a while. We kept knocking on the door. Finally, we got her to open the door, and there was blood and shit everywhere. She was cleaning it up. Okay. So we took her back to the room, and I was afraid that she knew she was pregnant. She had done something to herself. Mm-hmm. So the doctor started doing a vaginal exam on her. We had the lady come to clean the bathroom. She put the baby in the trash can, and then she put another clean liner over the top of it. Oh, wow. Okay. So when they looked in there, there was no trash in there, but it was underneath the clean bag. The baby's dead. Okay, we have him in trauma too, but she killed the kid.
Moments later, police and the charge nurse spoke to Alexi and her mother.
I'm sorry about this, but in terms of delivering a baby and it looked like you tried to hide it, you do have to have the police involved.
and nothing was crying. It came out with nothing.
I know. But the baby's gonna have to be taken for autopsy and there'll be an investigator and everything. I'm really sorry.
Okay, let's talk about this. It wasn't crying. The doctor says, I know. Now, she's not saying that she knows the baby was born dead, because
Right.
either way, it's tampering with a corpse. She's just like, yeah, okay, we have to still take it for an autopsy. She's just trying to get out of the room.
Correct. She's just pacifying him. I agree.
And I can't imagine anything more screwing up a shift like having to call an investigator and the police, or police, as Candace calls them, to the hospital to go through everything. You
Oh
have to-
yeah, something
you're
like
having-
this would be a major thing, Brooks. I mean, that you'd be after your shift for hours.
You've got patients and you're having to sit in the break room and go through what happened with her. Like he said, she killed the baby.
hmm
I'm the charge nurse here. Do you guys have any questions for me?
Like, how big is the baby?
It's full term.
What? 9 months? Nothing was crying. Lexi, have you watched the news of the girls that what they do to their babies and what they go to jail? Nothing was crying.
Joining me to discuss this case is somebody who I think is the perfect guest to do it. He is Jerry Dugan. He was a longtime prosecutor in the homicide division of the Philadelphia DA's office and is currently a medical malpractice attorney. So, Jerry, welcome to Sidebar. Thanks for coming on.
Sure, and Jeanette, glad to help.
Damn, Aunt Jeanette is grinning ear to ear like she just got a big old bucket of KFC put under her desk. Woo!
Yeah,
Woo!
this is a good.
Well, as tasty and delicious as it ever was. I'm Colonel Sanders. And I'm back, America. I'm back, America. It's still finger licking good.
I've never seen Aunt Jeanette smile like that.
She's happy.
Because she can smell the bullshit.
Mm-hmm.
She can smell it all the way from New Mexico to Atlanta.
Oh yeah.
I want your initial thoughts on the body camera footage in this case, but also the claims by Alexi Treviso. You see it in the body camera footage. It wasn't breathing, or there was no breathing, that type of thing.
Well, I think overall, Anjanette, the defense in this case and the approach that the defendant seems to be taking through her lawyers seems to be both desperate and dangerous. I think its desperation is based on the fact that there's really very little direction that they could take this. This is an adult. The woman, as I recall, is 19 years old.
Yes.
Who made the conscious decision to dispose of a fetus in a trash can and then cover it over in the bathroom of an emergency room. So you begin with the premise that it is difficult, if not impossible, to exonerate this woman. And apparently the direction the defense is taking is a very dangerous one, because they've apparently chosen to attack everyone else involved in the investigation and try to exclude this woman from any culpability. Specifically, the suggestion that the emergency room physicians are incompetent because they administered excessive amounts of morphine under circumstances which were not a deviation from the standard of care. And then coupled with that, argue that the forensic...
Okay, explain that to the layman. They are not a deviation from the standard of care.
I couldn't get my mic unmuted. Well, basically, he's saying everything they did would have been what a reasonable person would have done in the same situation, in my opinion.
Okay. So no malpractice.
Absolutely not.
In a nutshell.
No.
pathologist who conducted the autopsy, that his testing was what the newspaper describes in his own words as medieval. That to me is a very dangerous approach to the defense in this case, because attacking everyone else and attempting to exonerate a woman whose conduct borders and exceeds outrageous, in my opinion, is an act of desperation beyond many that I've ever seen before.
Obviously, they're claiming that this was a stillbirth. They've
Correct.
taken this route. They're filing, they filed a notice of intent to sue. So they're going a civil route. They're taking this to civil court. But obviously, it looks like this is possibly testing the waters for a defense in the criminal case. Like you kind of lay this groundwork, or you've got this other track you're going on, and trying to put all of this out there. They say on the body camera footage, the charge nurse clearly says she's been lying to us the whole time. She said she didn't have sex. She denied that she could be pregnant. Pregnancy test comes back. She's pregnant. She locks herself in the bathroom, won't let us in. We get the key. It's a bloody mess, blah, blah, blah. I mean,
Right.
It's unbelievable to me that they're trying to say, oh, it was the drugs that killed the baby and the baby was stillborn. She claims it wasn't crying, or he wasn't crying, yet they find the baby in a trash bag with a knot tied around it.
In the first instance, the autopsy that I understand was conducted found air in the infant's lungs.
Yes.
And assuming that's a correct finding, either something or someone had to prevent that oxygen from being expelled. And the most logical way to prevent the expulsion of oxygen in an infant or in anyone is manual strangulation, of closing off the airway. So the suggestion this is a still.
Okay, this is a lot. Let's go through this because this is really important. And this is going to be a huge part of the case. Was it manual strangulation, or was it what one of the nurses described, how the plastic of the bag was suctioned to his little face? Help me, Angel.
Yes, I think it was the plastic bag, because they did say on autopsy that there was air in the lungs. The act of putting the plastic bag, obviously, around the baby is basically suffocating. And it could be, the bag gets stuck to your face because there's moisture when you're breathing in air. Now, the strangulation kind of threw me for a loop. I didn't think about that. But right now, I'm just going to say that I think it was the plastic bag.
Yeah. I mean, when they described it, it made me sick to my stomach. I mean, at the autopsy, this is from Law and Crime, the autopsy revealed that the newborn did not have any physical abnormalities or injuries at birth, meaning not stillborn. It was observed that air was present in the lungs and stomach. So the little guy was trying to breathe.
Mm-hmm.
But you can't with a bag around you.
No. That reminds me of Evelyn Boswell. Mm-hmm.
Oh.
Yep. And I hope that he tries to find a case, that defense attorney. Good luck finding a case where morphine makes somebody suffocate their baby.
Oh, they'll find one.
And yet has oxygen in its lungs. And the claim that 0.19 nanograms of morphine was the causative agent. Keep in mind that a nanogram is 1 billionth of a gram. This was 1900ths of 1 billionth of a gram of morphine in this infant system. It is absolutely not a deviation from the standard of care in the.
Okay, we have more technical terms, Angel. Let me know if I need to rewind that, but you're going to have to explain this. He's explaining how much was actually in the baby's system.
Right. So what he's saying is that amount of morphine is considered the appropriate range, and it's probably on the low end of the normal range. So with that being present in that amount, that medication should not have contributed to any type of respiratory depression or difficulty breathing with this baby. Everything that they did was, when he says standard of care again, that means he's saying they did what anybody else would do. That's the normal thing to do. That amount of morphine is not going to have harmed this baby.
Is it safe to say, with the standard of care, none of us would be leaving the hospitals with our babies if morphine at that amount kills them like that?
Say it again.
Is it safe to say that none of us would have left the hospitals with our babies if that amount of morphine is that deadly? Would we not be seeing a rash
Absolutely.
dead newborns? Because it's what's
Absolutely.
in every hospital.
Correct. All the women that, for their personal reason, because they're progressing too far in their labor for whatever reason, they don't want an epidural, they don't have an epidural, it's too late, it's time to start pushing. That's what they're going to give, is the morphine. And how many people, as you said, walk out the door and there's no problem? So he's trying to put a problem when 99.99% of the time there's not an issue in this same scenario.
Tracy, she said, I breastfed after my C-section and they gave me a morphine drip. Yeah.
There you go.
There you go.
The emergency room to administer morphine to someone who was known to be pregnant. Morphine is used all the time for women who are pregnant in the emergency room setting, where it's monitored for things like extraordinarily back pain. So the fact that there was a fraction of a billionth of a gram of morphine found in this child's system did not kill this child. And I don't think the defense can possibly find a board-certified forensic pathologist who can say this baby was killed by the hospital. The argument here is you should accept what I call the Big Mac defense, that this child was not pregnant or didn't know she was pregnant. She was gaining weight as a cheerleader because she ate Big Macs every day. And what I think the defense is forgetting here, and I don't mean to malign anyone, but I've done this for more than a couple of years of my life. The jury in this case, when they could very well be using, if the defense was presented, in my opinion, properly.
Now, hang on. Of course she was eating Big Macs every day. You have a big appetite when you're pregnant, unless you're throwing up early on. So
right.
She was gaining weight in one area. Well, 3, 2 boobs and a belly because of Big Macs.
The Big Mac defense. I love this. Yeah, that's ridiculous.
Don't be blaming the Big Macs. And Tracy had a great point. I never even thought about that. Because with my third son, I had a tubal right after. And boy, that takes the wind out of your sails. So I was on a drip and breastfeeding. So miss me with that shit, Colonel.
Properly. To use the overwhelming sympathy for this mother who arguably panicked, as opposed to suggesting that everyone else is guilty except her, borders on the desperate and dangerous. And I think jury's nullification here could very well result in the jury, when they see this photograph of the cheerleading defendant, who clearly has, for lack of a better term, a baby bump, and then to suggest, well, that's innocent enough because my boyfriend and I go to McDonald's every day. I can't conceive of a jury in this country saying, oh, that's a reasonable defense. The hospital killed this baby. I just think that defense is going nowhere.
Hello, everyone. This is Robin Warder, host of the True Crime Podcast.
3 times a day and not gain an ounce. I mean, you know what I mean? It's like when you're younger and you've got this high metabolism and you're active.
Well, Zuckerberg is eating a ton of McDonald's right now for his fight with Elon Musk. Michael Phelps, he'll have like 7 Big Macs a day. How come they don't look like they're pregnant? My mother-in-law eats McDonald's all the time. She's chubby, but doesn't look pregnant. Snow. This is good for Angel. Google what's in an epidural. It's way worse than morphine. You want to weigh in on that, Angel?
No, I don't really know that without looking it up, girl.
Okay. Freaking me and my boyfriend eat at McDonald's every day. Well, then how come he doesn't have a baby bump?
Exactly.
Stupid asses.
Let me ask you, I know you're not an OBGYN. Okay.
Right.
I know you're not a
I've spent some
gynecologist.
time doing emergency room medicine, however,
Yes.
and
So,
OBGYN med mal work.
okay. So, but I was kind of going to get maybe into the weeds a little bit on that portion of it. You know, the baby does have air in its lungs. So
Absolutely.
when a baby is stillborn, what would you find in the lungs? Would you just find, like, I don't know, fluid, because they have to clean the baby's mouths out once they're born,
Correct.
usually clean out their noses and all of that stuff with all that stuff. So what would you typically find in the lungs of a stillborn baby?
I think what you wouldn't find is oxygen. And in a stillborn baby, my understanding from an OB perspective is the liquid that you would find in a stillborn baby would be just the opposite of what the forensic pathologist claims in his autopsy found in the lungs of this baby. It certainly assumes that the forensic pathologist did two things. He eliminated all other causes of death, including this minute amount of morphine, then found the presence of oxygen in an alleged stillborn baby, and by process of elimination concluded that something caused this oxygen not to be expelled, and the fact that the only thing that was left was manual strangulation. And I don't think there's any way around that argument.
They make it sound like, though, that the baby was put, according to the autopsy finding, that the baby was put in an airtight environment, such as the plastic bag. So the baby was kind of breathing, but then the baby runs out of oxygen, and therefore the baby suffocates. But you think it's possible she actually maybe strangled, choked the baby, or possibly smothered the baby and then put the baby in the plastic bag? Because I'm thinking to myself, this baby, once born, likely would have made some noises in that bathroom. And the nurse, according to the timeline, is going and knocking on the door and saying, hey,
right,
are you okay? Are you going to come out? That type of thing.
And I think you're 100% correct, but the one thing that may be lost, we are dealing with the forest for the trees here. What conceivably would be lost by defense counsel, but will not be lost by a jury, is that the conduct of this woman does not reflect evidence of innocence. It reflects evidence of consciousness of guilt. Her behavior after the birth of this child is counterintuitive if she had no knowledge of pregnancy and that she had nothing to do with the child's death. The first thing I believe an innocent mother under these circumstances would have done would have been to scream, yell, seek help, find someone that could possibly do something to help this child, when in fact, the evidence of concealment and the evidence of guilt are directly connected one to the other. I just think that the defense here is losing track of what a jury is going to be influenced by. And I think one of the things they'll be influenced by is taking a look at the cheerleading photograph, take a look at the post-birth behavior, and then, in my opinion, be offended by the arguments that everyone else is at fault except the mother. I don't think enough attention is being paid by the defense to what a jury's reasonable reaction to this case would be.
I love this.
That was
Because
wonderful.
we've never been able to get over is the reaction after being told that your grandson, your son, your grandson, your son was face down, wrapped in plastic, in a trash can. When what we are seeing is shown to the jury, and they're going to see all of it, not just what we're shown. What do you think their reaction's going to be? Safe to say you're going to have some parents and grandparents on that jury.
Yes, I love when he started talking about what the jury's perception would be of this. there's no getting around her behavior in that bathroom. And I loved it when he said, you know, a normal instinct in a woman is to scream, say, "Oh my God, help me, pull that cord." You know, she did the opposite of that. And then you got to note the apathy, the lack of concern, really, that you see in the mother. Her only concern is what's going to happen to my Lexi. So I think that what he's saying is spot on. I mean, people are not stupid. You know, I think that she's going to look bad in the eyes of the jury, especially with the women.
And I don't think this is going to help her case either. A few months after the death of her son, they're still eating Big Macs. Where's the belly? They're still eating McDonald's. We don't have a baby. We don't have a baby bump. That's with baby daddy.
Yeah, that's just disgusting. I think people would say that as very disgusting. Just go on about your life like nothing happened.
Then, of course, we have this. Detective Gonzalez tried to contact Devin, that's the boyfriend, on his personal phone. He advised Devin he wanted to talk to him to interview him about the incident on January 27th, 2023. Devin said he'd call him back. He left him his phone number. He called him back on February 16th. Devin said he didn't want to talk to him. Devin has nothing to say. If I was Devin, I'd be filing a wrongful death suit against Alexi. But instead, he's on this malpractice train thinking he's going to get some money because he's going to be named in the suit. It's sick.
And I think it's going to be something that will reflect outrage on the part of a jury that this is an argument that is turning away from a mother whose conduct is difficult to describe or accept and make everyone else culpable. I don't think any jury, in my opinion, is going to buy that argument.
So if you're representing the hospital and you receive this notice of intent, you know, to file a lawsuit, a civil suit, you're representing the hospital and, you know, and therefore the doctors and nurses who were involved in her care. What do you do when you receive this? What's the next step?
Well, the next step is exactly what I would have done here if on the defense side of the hospital. The first thing I would have done, obviously, is make sure that all of the charting of the admission of this woman was done accurately and that it is reflective of what actually happened. But more importantly, as a defense lawyer for the hospital, I would have retained not only a forensic pathologist, but a forensic toxicologist and also an emergency room expert. Number one, that the emergency room expert, board certified, would hopefully testify that it is not a deviation from the standard of care to administer morphine to a pregnant woman. And in fact, it is not a deviation from the standard of care. The second thing I would do is to have a forensic pathologist review the autopsy findings and hopefully agree that the forensic pathologist for the state who did the autopsy did it properly. And finally, I'd have a forensic toxicologist to testify that 0.19 nanograms of morphine under no circumstances contributed to the death of this child. That'd be the defense the hospital would present.
If they give, you know, Alexi not only the morphine, but the other drugs mentioned by her defense attorney, you know, so you're saying it's just such a minuscule amount. Even if she's saying, no, I'm not pregnant. I've never had sexual intercourse. No way I'm pregnant. I'm getting periods and all of this stuff. You're saying that the amount of morphine, because he's directly attributing it to the morphine, even if you didn't know she was pregnant, it was so minuscule that no way this ever causes a baby to stop breathing.
Absolutely not. That morphine is administered to pregnant women in emergency rooms all the time. It is not a deviation to do it. It's done regularly because of severe pain. When there is knowledge that a woman is pregnant, morphine is still administered under certain circumstances. And the incredibly minute amount of morphine that's found here, I don't think any board certified forensic toxicologist is ever going to testify under oath that this amount of morphine contributed or caused the death of this child. I just cannot conceive there is a board certified expert out there that could honestly say that, because it's not correct.
Her attorney is also saying that the baby was positive for COVID and influenza A and B. Obviously,
Right.
we know that influenza can be fatal in babies who've not, if they have asthma and other, comorbidities. Those are other conditions that could, babies and kids die of the flu every year. So you're saying, like, even with under those circumstances, because those are respiratory illnesses, no way.
What I'm saying is that if in fact, and I have to assume that the state of New Mexico, where this case I understand is pending, as a board certified, fully qualified forensic pathologist who does autopsies for a living, looked at the toxicology, looked at the autopsy, and concluded, with nothing to gain or lose, by the way, that these did not contribute to this infant's death. There's no motivation on the part of the forensic pathologist who works for the state of New Mexico to say anything other than what the conclusions, in his opinion, are correct. On the other hand, I assume that the defense will try to identify a similarly qualified forensic toxicologist or pathologist to say the opposite. And it comes down to a battle of experts. But Anjanette, at the end of the day, what I think is being lost here is what a jury is likely to be influenced by. A woman who has categorically, repeatedly lied, then her conduct in the bathroom is certainly consciousness of, in my opinion, of guilt rather than innocence. And the argument about a Big Mac defense, again, this is being lost in the weeds by back and forth minutia between experts. I don't think a jury will pay one bit of attention to that, and may very well be turned off very early in this case by looking at that photograph, listening to what the nurses say, reflective of how many times this woman lied, and then being outraged by the Big Mac defense. I think you can have all the experts in the world you want, but remember, a jury is going to decide this case, not a forensic expert. And that's what I think is being lost here.
Well, Jerry Dugan, thank you so much.
And I couldn't agree with him more. Obviously, that's above my pay grade. But when we're talking about everyday citizens, you're judged by a jury of your peers. No one's going to look at these pictures and say, she just thought she was getting fat from Big Macs. Okay, we've all been 19 years old. You gain a pound, hell, you may not eat for 3 days. You're so freaked out. Sorry, but it happens. I'm not saying you should. I mean, my goodness. When I was a teenager, I could just not eat for a while and I would lose weight. If I thought Big Macs were putting that belly on me and I had a boyfriend that likes to do the horizontal boogaloo, I feel like I'm going to have to lay off the McDonald's.
Right. It's funny that they're not talking about that weight loss drug she was taking. Ain't no ER gave her that. She was taking that herself. She was taking a weight loss drug, remember?
Yep, you got that right. She had phentermine in her system.
Mm-hmm.
So get ready for the Big Mac defense. We all remember, even though it's been a while, when we were teenagers, you put on, you look at everything. You're like, oh my gosh, my legs are fat. My ass is fat. Oh my gosh, what should I do? How do I get my boobs to grow more? Of course, you're not going to do it that way. Oh, I'm eating McDonald's every day. Maybe I need to stop that.
Right. The Big Mac defense. That's really funny, actually, but unfortunately, I have to laugh at that. That's just ridiculous.
Well, the whole thing is ridiculous. I can't tell you how many women have reached out to me since we started covering this case, and they're like, as soon as I went to the hospital, with a, pain on the pain scale of 10, they gave me morphine.
Yeah.
My goodness.
It's a common story that you hear from everyone. I just love that man that was on there with Anjanette. She was so perky and happy he was on there. I feel like that he addressed everything very well. And that's where I got that consciousness consciousness of guilt statement from girl. But I really, really think that if I were on a jury and I heard all these different things that were present, and then the baby had air in its lungs, and all that, you know, that doesn't take away from what she did in the bathroom, period.
No.
And they're trying to focus people's minds on all these other things that could have made her do that. Well, there's no reasonable explanation for her not pulling the cord, not screaming for help, and then putting it. And now you got to understand, she didn't just put it in the garbage. You know, housekeepers frequently in hospitals and facilities, they keep their extra clean bags at the bottom of the can. Then they have their bag that's got the garbage in it. This girl went to the trouble of getting a clean liner, putting it on top of the baby that she'd wrapped up, so that when people looked in the trash, it would just look like an empty trash can. That is more effort trying to cover up that baby.
More effort. Yeah, you're exactly right. And she spent a lot of time in there. They kept hearing toilet flushing, water, paper towels. Finally, they're like, we're coming in there. So not only did she wrap a plastic bag around his head and put him face down, she put more stuff on top of him so they would just take the trash out and not even realize that he was in there. And I couldn't agree with Melanie more, because we have an issue in some of our schools. I can't say all, because we have to admit our kids are at school, well, not mine, more than they're with us. So when it's part of the curriculum that they're teaching them that a baby is just a clump of cells doesn't mean anything. And I cannot believe what I've heard about what's going on in some of these schools. It resonates with these girls because we have too much going on.
Yes, you're exactly right. You're exactly right.
And then, of course, we have the denial by her mother. I mean, she would not wrap her head around the fact that she's not, she's the captain of the Titanic. That's about it. But she cannot run what's going on. And the more,
I'm sorry. She's what's wrong with that girl, too. I tell you what. Brooks, I don't mean to change the subject. I know you're going into the denial, but back to the other thing about the infants and all the things they're teaching. I'm going to share with you all a story. When I was in nursing school, I guess that was 1981 or 82. We had to go to Planned Parenthood and observe an abortion. And with the stipulation that, you know, if it bothers you, if you don't want to see it, yada, yada, you don't have to. Girl, I went in there. They started to do it. I said, I can't sit here. I can't do it. I left and went in the waiting room. Well, the waiting room was full of pornographic magazines. No joke.
What? Why would you have porno magazines at the abortion clinic?
It was fine. But I would never, ever want to see that ever again.
Oh.
It's horrible.
And don't get me wrong, I totally understand if you talk to a woman and they say, listen, you're not going to be able to carry this baby. You're just not going to be able to, and they have to make that decision. I just couldn't imagine, you know, and most women that I know that have been forced with that, they're like, no, I'd rather die. And they're like, I don't think you understand what's going on. This baby's not going to survive. I mean, you name it. But this, I just, you know, I don't even know what to say about that.
It's very disturbing.
And I think it's disturbing, too, the way that her mother was trying to circumvent what was about to happen. Now, mind you, she wasn't pissed at the hospital in January when they went home. February, March, April, May, June. She wasn't pissed at the hospital about her grandson being dead then in a trash can. It took a first-degree murder charge against her daughter and then brainstorming with Colonel Sanders to bring malpractice against the hospital, which as of right now is just a letter of intent. So they're going to get their attorneys involved, and they're going to go through all their charting, all the records, the time, the UA he spoke about where she was dehydrated and couldn't give them a sample, but they knew she was in extreme pain. They've already said that the morphine was minuscule in her system. How are they going to fight this?
With desperation, obviously.
Well, and you have to remember, there are several nurses that want to keep their license. You can't tell me everybody in that hospital failed her. There's
No,
a
that's
doctor.
awful.
There's
That's awful.
There's a doctor. There's two doctors. There's an
Mm-hmm.
ultrasound tech.
Mm-hmm.
And they don't, and let me tell you what, Alexi, her mom, Mr. Boyfriend's mom, Colonel Sanders, none of them care if these people lose their entire livelihood because of Alexi's self.
Yes.
All right, this is when the detective calls Rosa. Listen to the defiance.
Hello?
Hi, Miss Rodriguez.
Yes, sir.
Hi, this is Detective Gonzalez, Artesia Police Department.
Who is this?
Detective Gonzalez, Artesia Police Department.
Yes, sir.
Hi, I'm calling you today.
Listen to Rosa. Who's this? She knows who's calling. Detective Gonzalez, Artesia Police Department. She's like, oh, hell you want?
Because I tried to get a hold of Alexi at school.
Why would you go to school? Why wouldn't you come here to my house?
Well, because you told me that I need to speak with a lawyer before you talk to me. But I need to hear that from Alexi first. Would she be willing to just tell me that in person at your house?
Okay, why? What? Yeah, I'll have her tell you. Tell her you're only going to talk to him with the lawyer present.
I need to hear it I have to be in person, man, so I know it's her.
Hello?
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 Hi, this is Detective Gonzalez.
Okay.
Hi, is this Alexi?
Yeah.
Hi, ma'am. I just need to meet you in person. I know your mom told me for you that you want to talk. You would only talk with a lawyer present. I just need to hear that in person, okay?
Well, I will only talk with the lawyer present.
I just have to hear that in person, okay? When would be a good time to meet you? To tell me that in person.
You can come to my house right now, Detective Gonzalez, if you want to. I'm here and she's here.
Okay, that'll work. I'll head that way then.
All right, thank
All right,
you.
thank you.
You know he was shaking his head. Why did you call the school? Because Rosa, from the get, was so upset about people in town finding out. She wanted this to be basically a dirty secret. That's it.
Yeah. Oh, yeah. Very, that phone call was painful, but yet you noticed how professional and nice he was to them. And they were just that was like dealing with a bunch of passive aggressive teenagers. They just didn't want to cooperate at all, even on the phone.
And if you ask me, just my opinion, I think they have been bending over backwards for Alexi and her gangster mama. We're going to get to that in a second. $100,000 bond, so she got out on 10 grand. They probably borrowed against their house. Allowed to attend high school, school and graduation. No ankle monitor or be under house arrest, and counseling. We're talking first-degree murder. We're talking first-degree murder.
That's pretty accommodating, huh?
I would say so.
You know, I bet those nurses, if what happened had not happened in the ER, I bet it crossed one nurse's mind. I know it would have mine to say, think we might need to get a psych consult on her while she's down here. but they didn't have the chance to do that. Everything happened so fast.
Well, and there's also a difference between presenting to the ER where there's a lot going on as opposed to being in a regular room.
Exactly.
They're going to have to look at what else was going on at the ER. Was someone having a heart attack? Did somebody come in with a car wreck, broken leg, dislocated shoulder, chest pains? All of that matters.
Right. That's priority over back pain.
This is on the channel Back on My BS. She's got 974 subscribers. I think she's doing great work. I'm going to put her link in here. Sub up and look at it. C-Care RN said there is no way the mother didn't know her daughter was pregnant. I don't think so either. There's no way boyfriend didn't because, well, they were still having sex. There's no way boyfriend, Mr. Boyfriend's mama, Devin's mom, didn't know. Because if, let's say my daughter-in-law came over, I wouldn't assume she had been eating a lot of Big Macs. I'd say, oh my, when is she due?
Yeah.
I wouldn't say, oh, you got to lay off those Big Macs.
Right. It's ridiculous.
All right, this is a little bit on Rosa. It explains a lot as to why we have this defiance in the case of her grandson.
History for forging checks. So her mom is also an extremely dishonest person, and these arrests happened in Colorado. So a lot of people have been saying that they are from Artesia, New Mexico, but that is not true. They are actually from Colorado.
That's the mom?
Mm-hmm.
So that is 4 different times that she was arrested, and that was from Gaines, Colorado. Out of those 4 different arrests, she was charged with 6 different crimes. Twice she was charged with disorderly conduct, and 4 times she was charged with faking checks, so check fraud. And these are from 2004 to 2014, so they would have been when Alexi was a baby to about 10 years old. So her mom definitely has a history. And then it turns out that isn't even where the history stops. So in July 17th of 2004, so when Alexi was only 7 months old, the Department of Corrections in Texas charged her with driving while intoxicated with a child under 15 years of age in the car. And she pled guilty and took a 5-year probation sentence. And we know that she has ties to Texas because, so get this, this is the lady who hit and run my car in Waco, Texas. She is the mother of a daughter who recently got arrested for killing her own newborn.
So this is what I found today. And we know that Rosa lived in Colorado because, like I said, we just went over all of her arrests from 2004 to 2014 in Gaines, Colorado. But this is from June 27th, 2012. And it looks like she lived in Pueblo, Colorado, at least briefly as well. So this would have been when Alexi was 8 years old. Rosalinda Rivas, 29, of the 2000 block of East 13th Street, was arrested Monday on warrants for bond revocation and identification theft. She was being held in jail in lieu of a $50K bail. Bro. So she's got 4 check forgery charges already.
2 disorderly conduct charges. She has her DUI while driving with a baby from Texas. And then this identification theft and bond revocation. And this is before the hit and run in Texas. So that's
great job to back on my BS for digging all this up. I wouldn't have known where to start. You guys know about my deep dives. Extra AF, I know she's eating this up. She's got a Big Mac and some Cheetos ready. She said, well, well, well. So, Angel, what do you think about this with Rosa's past?
Oh my God, what do I think about it? First of all, I'm so shocked that she was ever arrested for disorderly conduct, and that's a joke. I can see that, you know. I kind of wish they'd got her when they went to get the daughter to take her to jail, the way she was acting. But you know, so that's the behavior that the daughter has seen growing up, which is secretive, dishonest, and under the table. And she has taught these maladaptive coping mechanisms to her child. Her child is the daughter. I don't want to say child. The daughter is mimicking what she has seen. And so she's not been raised. I mean, she didn't, I don't mean to be, okay, I'm not going to say that. She has not been a good example. This is why we have what we have today.
I agree. And you can
Do
say
not accept
you don't are around here. And when we did our first show about Alexi, and I think it was in a week in review, Extra was coming unglued. She wasn't taking up for Alexi, but she was telling me over and over. She said, look at the mom, look at the mom, look at the mom. Thank you, Extra. And here we are.
Yeah, that's pretty crazy. Identity theft, check, and disorderly conduct, driving with your child in the car, intoxicated. Wow.
And back in the day, I've bounced some checks, but I didn't go and use other people's identity.
Yeah.
And write checks. I mean, I have floated a couple checks like, well, the paycheck's going to hit on Friday. If I write it on Wednesday, that can be explained.
Right.
But to write checks on a closed account, you know you're defrauding someone.
Yeah, this mom is so dysfunctional.
before this, but yeah, so just absolutely absurd.
So, kind of going along the same train of thought, there's been some thoughts as to how is Alexi's mom affording this defense. And so shout out to the Rabbit Hole. They provided these screenshots, and we're going to go ahead and read them now.
Okay, so this is allegedly from one of Alexi's classmates. I have not verified who this person is. I am just going off of the fact that another channel has decided to use these, so they find them credible. And
these were also discovered by the Daily Mail. This girl, if it's the one I'm thinking of, was on the cheerleading team with her. Doesn't matter who the girl is. I'm not going to track her down.
And, you know, this is just my opinion based on what I'm reading. Do you know how her family could have possibly gotten all the money for her bail and attorney fees? Because I know her attorney isn't cheap, and there's a rumor going around that Mac Chase might have helped with that, but I don't know if that's entirely true or not. Which I don't know who the fuck Mac Chase is. If you do, please let me know in the comments. Thank you. It's just what a few other people said. And then the classmate says, both Alexi and Devin acted as if nothing happened. At first they were quiet about it, then acted normal. Alexi in and outside of school is very entitled, snooty, and self-centered. She was a good friend, but at times let her ego get in the way. She always has worn baggy and loose-fitting clothes since freshman year. Her family is very strict, especially her mom, but her mom is also a very nice lady. Alexi comes from a kind family. And her mom always has nice things, rather, that being Gucci, Louis, Chanel, Lululemon. Alexi, mom, believe I has her own little business making Scentsies for cars. I'm unaware of what her stepdad did, but I know that they had money. What about Devin and his family? And has Devin said anything to anyone about the situation since it happened that you know of? Devin comes from a very kind family as well. I didn't know Devin as well as I did Alexi. I'm unaware of if Devin has told anyone. I do know Devin has been cheating on Alexi for a while. And the day she was arrested, Alexi had found out Devin cheated on her. Devin has always...
Sounds like a good motive. We can smell a cheater 50 miles away.
Yep.
So if Devin was cheating on her, and even see the day she was arrested, he was with another chick supposedly, because his mama showed up to the house. Devin didn't, and it was at school time. It's not like in May he was at football practice or anything, or band practice. This is the end of the school year.
Yeah.
And this Mac Chase they're talking about, he's an American oil and natural gas businessman who made his money in the oil fields of Texas and New Mexico. He's from Artesia. Supposedly, the stepfather knows him. I don't know. Don't quote me, but that's who they're talking about.
She's been one of the well-known students rather than Alexi being more to herself. Of all the days to find out you're being cheated on, man, that is just like to add insult to injury. To find out that your boyfriend's cheating on you and then you get locked up for 6 days. That is shitty. That is real shitty timing.
Yeah, and I'm not going to sympathize with Alexi. I'm not going to sympathize with her, and I'm not saying that this woman is sympathizing with her. But we go back to what we've said on the show many times before. You pull something like this, here, you get one shot. If I was a judge, a governor, a senator, then guess what? You get fixed, and so does Mr. Boyfriend. Because like Nicey Marie said, just think if he gets another girl pregnant. Does his new boo know that he's part of this malpractice suit, or right now just a letter of intent? Extra said I could care less about her broken heart. Fix them.
So at least to me, and just my stupid layman mind, it makes 100% sense that someone like Rosa, who commits fraud regularly, would be able to finance, like Gucci and Louis Vuitton and an expensive ass defense attorney. And it's probably not through legal means because, look, it's Rosa. It looks like Rosa never makes her money legally. That's why she left Colorado. That's why she left Texas. That's why she's in New Mexico, honey. Like she's been leaving all the states where she keeps getting caught up.
And she's 100% right about that. Like when she had the hit and run in Waco, she got the hell out of there. She ran into all these problems in Colorado. She got the hell out of there. Last I heard, Alexi is not in New Mexico. She's with her real daddy, her bio daddy, in Texas. Jimmy said she's a runner. What do you think, Angel?
Yeah, she could be. This is just like the ultimate selfish thing to do, and her mother obviously has a pattern of sweeping stuff under the rug, it's all about her image, but yet behind the image is all this terrible stuff that she's done. And, she's taught that to Lexi. So I can see now why she had the attitude that she did, partially because her mom's like that.
Because her
Her
mom
mom wasn't upset that she had a grandson that had just been, well, offed. Her mom didn't shed a tear for the baby. Her mom shed a tear for Alexi going to jail. And what's going to happen to Alexi?
now, considering her criminal past, and I'm just thinking outside the box, I'm doing a deep dive with you, Angel. I'm wondering if she wasn't worried about her own ass as opposed to Alexi's.
Yeah, that's a good question.
Because she knew that detectives were going to be swarming. She knew that her criminal past was going to come out, and she didn't want any part of it. That's why that's where I think the defiance came from. Because she's talking to him like Teardrop does in the Harmony Montgomery case. She's very defiant. Do you think that could be a possibility, Angel?
Something cut out. I didn't hear what you said.
Oh, I'm sorry. I said she's sort of acting like Teardrop in the Harmony Montgomery case. I'm not talking to you guys, just total defiance because she already had run-ins with the law. Do you think that could be it? It couldn't be maybe so much about Alexi, but them digging up her past and saying, hey, we got to look at you.
Sure. I would believe that. Absolutely.
And I'm with Crafty Chris. We got to weigh in on this. Love how she was quick to blame her bio dad for abuse. Yeah, she said he abused her when she was pregnant with Alexi. That's why Alexi has back pain and constipation. She got, I guess, scoliosis or something from when she was getting beaten when she was pregnant. But where is Alexi now?
Right. If that were true, she wouldn't be where she's at.
Yep. Well, it's getting ready to come out, if my sources are correct, and they've been wrong before, that part of the letter of intent is not just about the charge nurse, not just about the doctor. They haven't named the ultrasound tech, but they also are after the housekeeper.
Oh, no.
Now,
what did she do?
Well, I couldn't tell you. When you're cleaning up at a hospital, you don't expect to find a human baby in the trash.
No.
And this woman, if I was her, I'd get in front of this ASAP and I would sue Alexi for, I don't know, emotional distress, PTSD, or something.
Mm-hmm. Yes, it could keep going. Lost wages, emotional trauma, PTSD. Let her have it.
Hell, people sue for hair in their hamburger.
Yeah.
Sue her.
Mm.
Hi, man.
Hi. Hi, Miss Lewis.
Hi.
How are you doing?
Good.
No, I'm good.
Okay, thank you.
I'm just a mentor.
I'm Leah Lewis.
Nice to meet you.
Same thing's also met you the night of.
Yes.
Let
me turn off my phone.
It's okay.
That's fine.
Yeah.
Okay.
So, can you tell me everything that happened on January 27th?
Okay.
Like your involvement from
The time I was called.
Yeah, to the end.
Okay, I was called and to go clean the patient's bathroom in ER around, I can't, maybe 2 o'clock or so. I think it was the time. I'm not too sure. So when I went in there, it was a gory, bloody massacre mess.
Could you describe it if possible?
Yeah, there was blood everywhere. There was blood on the floor, on the wall.
Do you remember which wall?
The one behind the toilet, and then the one on the side right here. You know, there's the one where the toilet sits, back of that.
Yeah.
And then on the side.
Where the call button is?
Yeah.
Okay.
And on the floor, everywhere. I mean, it
was it like this is the bathroom. Here's the toilet and the sink. then here's the door. So was it just like this, or?
Actually, it was all over the place, all over the floor, because even when I was going into the bathroom, there was blood on the coming out of the bathroom on the floor.
Okay.
So it was everywhere.
Okay.
So there's blood coming out of the bathroom? Do you
Yeah,
know how far it went?
footsteps.
Okay.
I think they were the person that was in there, her footsteps. And she was coming out, so I was like, oh my gosh, I mean, it's even out here.
How far out did you have to clean to get it?
From the outside,
Yes.
right by like around the water fountain,
Where's the water fountain at?
right there.
Oh, right next to the restroom?
Yeah.
Okay.
Before we get into the rest of this, because it really needs to be looked at, Ruby Slipper said Sue McDonald's. Yeah, there you go. You said you didn't know you were pregnant because you had that Big Mac belly. Actually, what you had was a D belly, if you know what I mean. How on earth can you blame the housekeeper? You can't tell me she has any kind of medical training at the hospital. It seems to me that she alerted the right people right away.
Yeah, I don't get where they're coming from with trying to put anything on the housekeeper. That's ridiculous. And I'm thinking that when she got that umbilical cord, she must have had a little bit of an arterial bleed somewhere because the blood was up everywhere on the walls and stuff. You know what I mean? Like blood squirting here and there, and like it does when an artery is, it comes out with a lot of pressure.
Explain what that means for people like me.
Well, an arterial bleed, that's where your blood is pumping when your heart contracts, and that's where they draw like your blood gases and stuff from. It is I hope there's another nurse in chat that can help me with this, but long story short, if you sever an artery, you're going to get like a water hose. You like blood shooting out, okay, versus a vein where the blood is returning back through the cardiac system. There's extra pressure because when your heart contracts, that circulates your blood through your system. Any type of artery, like a lot of times, if people stab people in the femoral artery, example, or up here in the carotid in your neck, you're going to get massive blood loss and bleed out really quick.
Could that be from her ripping the umbilical cord?
Yeah, that's what I'm wondering, because I don't know how else there would have been blood squirting up on the walls and everywhere. I think that something got severed and, just squirted everywhere, behind the toilet, on the walls. I mean, that sounds like a pretty bloody scene. It would have to be something like that. And this poor housekeeper, oh my God, that just infuriates me.
It just really makes you wonder, in the world of common sense, how Alexi thought that she could hop back in that bed and no one know that she gave birth.
Right?
And that nobody would come across the baby.
Did she think she was just going to leave the hospital and leave the baby there and nobody was going to find it or be able to trace it to her? I mean, that's ridiculous.
Well, I mean, the truth is she could have left the hospital had she hit the cord and said, I had a baby. I'm ill-equipped. I don't want another.
That's right.
It would have been, nobody would have known. She could have gone to prom with Mr. Boyfriend. This would have gone away, believe it or not.
Yeah.
Seems like Rosa, who, as we know, Rosa has a history. Fraud, identity theft, DUI with a child in the car, hit and run, you name it. It's not like she would have been shocked that her 19-year-old daughter was having sex. She's not some straight-laced woman.
No, I think she knew they were having sex. They spent the night together a lot.
She knew.
If it's on the left.
Yeah. So it went out to the water fountain. Did you have to clean like the hall or anything at all?
I mopped up that area right there.
Okay.
And was it footprints?
Yeah, it was.
Was it footprints in the hall?
Yeah, when, I guess she stepped on it, and then walked out with it, and then their socks were wet.
Okay.
But it wasn't all the way to her room or nothing like that. It was just right by the water fountain.
So just footprints in the hall to water fountain?
Yeah.
Okay. And what else happened?
Okay, then I went in there, and then I started cleaning. I started, first thing I did was I started mopping because we can't be walking around on that blood.
Okay.
So I started mopping, and then I started, after that, I started wiping everything down. Then I went to the toilet, and I cleaned the toilet, and then I got everything. I had to do everything like twice because it was, bad. I wiped down the walls and everything. And after I did all that, I usually throw my trash first, but for some reason that night I had to clean the floor up and everything else. And when I went to go through the trash, I felt that when I picked up the trash and I looked in it, there was there was trash in it, but I knew that it didn't feel like when I picked it up, it was some weight. So I thought it was the trash bags because we put the trash bags on the bottom.
Mm-hmm.
And so I started getting the trash out. And then when I did that, I seen that there was a baby in it. And that's when I freaked out and I called Lori and HT, or the nurses up front. And because there was a baby in the trash. And the baby, when I looked at it, the baby was wrapped up like in a, like at the bottom of the trash can and with trash on top of it in a trash bag.
And so how did you see it like as soon as you picked it up?
No, after I picked up the trash bag that was on top,
Okay,
where
so
they were throwing the trash at, when I picked that up to change it, that's when I noticed that there was, when I seen the baby.
Okay, so you lifted the liner and then saw
Yeah.
the baby, okay. And I know it bugs you, but can you like describe the baby?
Yeah, he was about that big. He had hair. And
they honestly want to name this woman in the suit. She's describing his hair. He's about this big. The jury's going to see pictures of little baby Alex.
Mm-hmm.
They're going to see his hair. They're going to see his chubby cheeks.
Yep.
They're going to have someone explain that he was gasping for air while his mom jumped in, or egg donor, jumped in the bed and was like, "See, Mom, I told you."
Yeah. Just feel really bad for her.
I do too. This is not something, even the most seasoned, trained medical professional would gasp at that scene. A baby with a plastic bag around his little baby face. So you're telling me that the housekeeper should be blamed for any of Alexi's actions?
Mm-mm. That's so selfish. Oh, it's so selfish. Selfish to the core. Mm.
Yeah. And, he was like purplish, but still not like pink. I don't know how to describe it. He was like, he wasn't bruised or nothing like that. And he was like purple, pink skin type color.
Okay.
How was the bag? How was the bag placed, or what?
It looks like she wrapped it around like that, and then wrapped it like under him, and then put him on the bottom of it.
Okay. And was the baby moving at all?
No.
Okay. Did you touch him at all?
No.
Okay. And so you said you called HT and Lori?
Yes.
Okay. What happened? What did you see after that? What did you do?
Okay. When all that happened, I moved the trash can. I told him that there was a baby in the trash. I could barely talk at that moment. And so then they took over, and I left. I went up to the nurse's station. And then they called the doctor and everything and all that stuff.
After that, did you have any contact with the baby?
No.
Okay. And then what happened after that? After you went to the nurse's station?
Oh, they all went over there with the baby.
What did you do?
I just stood there and I was freaking out, and everybody was, asking me what's going on and whatever. And I didn't go back over there where they were at. Okay.
And then was that whenever I showed up, or?
Yeah, that was about the time you showed up.
So you were just at the nurse station until I showed up and talked to you?
Yeah, well, after that, I went back to EVS, to the department I work at.
Okay.
I went over there, and trying to get away from that for a moment. And I went there for a little while, and then they called me and told me that you were coming in, so for me to go wait in the ER.
Okay.
She's about to break down. You can hear her voice trembling. She said, so I went to a different department to do her job. She said, just to get away from that, because she's never going to erase this from her memory.
No, never. I would have PTSD if I've seen some weird stuff and some gross stuff. Okay, but that right there I would have PTSD. That's horrible.
Oh, it is. It is. And then we have other medical professionals that they want to go down for too.
Yeah.
We have others. When I look at this charge nurse, knowing that he's going to be named in this lawsuit, he's a former Marine. And when he said, she didn't even give me a chance to save the baby. Listen to what he says.
It's what seasoned medical professionals called a bloody massacre, comparing this crime scene to a horror movie. Brand new body camera captures the unsettling aftermath when a high schooler gave birth in an emergency room bathroom, allegedly killing her newborn son.
I've never, ever seen a reaction like that girl.
On January 27th, 19-year-old Alexi Treviso was admitted to an Artesia, New Mexico emergency room after complaining of back pain. Her newborn son was later found stuffed inside a trash can in a bloody bathroom she had just used. The high school senior was charged with first-degree murder and tampering with evidence before her graduation.
We discovered a dead baby in the bathroom.
Oh my gosh. I'm sorry. It came out of me and I didn't know what to do.
Long Crime Network first brought you the chilling body camera video last month when medical professionals
Okay, I'm not an attorney. I'm not a medical professional. But to me, this is an admission of guilt. Or as Angel said, consciousness of guilt. She said, I didn't know what to do.
So when you don't know what to do, you decide to cover everything up. It never crosses your mind to ask for help.
That's what I want to know. You have a pull cord. Don't tell me that when she was going to the bathroom, they didn't say, if you need anything, hit this cord or yell or knock on the door.
Oh, yeah. Oh, yeah. I'm sure they were highly suspicious of her, and they're going to want to protect themselves. So I'm sure their documentation is great. But yes, they would have done that. That would be standard. The mom doesn't even seem that shocked to me when she goes, oh, wow. She doesn't, I don't think she even seems shocked.
Lexi, we talked about this. You've seen the news. I'm like, no. It makes you wonder if there's not some sort of premeditated plan.
Exactly. Think about your own children or your own daughters, and under what circumstances would you actually have that conversation with somebody? I mean, your normal daughter being pregnant, you wouldn't say that to your daughter unless you had a reason to.
Bingo. Unless you had a reason to. She's covering her own ass.
Yep.
Old Gangster Rosa is covering her own ass. She knows when the shit goes down, they're going to look at her criminal history.
Yep.
And with good reason.
Oh, yeah.
Confronted Treviso about the baby.
See, I told you about this. I just asked you, baby, to tell me the truth. It was not crying or nothing. What did you do to it?
Now we're hearing from medical staff who uncovered the gruesome scene after she gave birth.
When I went in there, it was a bloody massacre.
Body camera video shows police officers.
Okay, now we really get to it with Gangster Rosa. Yeah, OJ's having a fit. It's his lunchtime. He thinks. Well, every minute's his lunchtime. She said, what did you do to it?
It.
Well, it. She looks straight at Lexi. What did you do to it?
Mm-hmm. It's disgusting.
They're speaking with medical staff who worked the night Treviso was admitted into the ER.
She said she needed to go have a bowel movement, and that's kind of when the whole thing happened.
Hospital surveillance video shows Treviso leave her patient room at 1:38 a.m., waddling toward the bathroom while clutching her back. Treviso remains in the bathroom for 19 minutes as multiple people check on her.
I knocked on the door and I said, "Are you okay?" And she said, "Yes, I'm fine. I'm just having a hard time going to the bathroom," is what she replied. So I was like, okay.
At some point, I went and kind of checked on her, knocked on the door, seeing if she needed anything. She denied. She said she didn't need anything.
Did you hear anything?
I didn't hear anything.
Flush, toilet flush?
Yes. After a while, I started hearing. So I probably checked on her 2 to 3 times. I'm not exactly sure. And then I just kept hearing paper towel dispenser and flushing and like the water running. And I knocked again. Did she need anything? Denied anything. And then eventually it got to a point where I said, "You need to come out." And I asked the clerk to get the key to unlock the door, because obviously she locked the door to go to the restroom. And whenever we finally had the key to unlock it, she opened it and just kind of walked out. And
did she say anything at that point?
She didn't say anything. She was just looking kind of straight past me and went back to the room.
Surveillance video captures that moment as Treviso leaves the bathroom and heads back to the patient room. It was then that hospital staff got a look at the bloody bathroom for the first time.
And all I saw was like blood everywhere, like on the walls, on the toilet. It just looked like a horror film.
Police speak to multiple people who saw the bathroom, describing fresh blood on the walls, floor, and near the toilet.
The toilet's right here where you're at, and then the sink's right here. It was like up this way, blood splatter.
What?
Like,
In your line of work, what would cause that kind of splatter?
I think something that got pulled out or ripped. Like,
whoa, she's not the only medical professional that has said this. Angel speculated on this earlier today. She said something got pulled out or ripped. Anique said, "I'm a great grandmother and have never seen something like this." Angel is a proud grandmother. Angel, now I know it's hard to wrap your mind around this.
Yes,
but
ma'am.
If you took your child to the hospital and they came to you and said, "We found a baby in the trash," what would you do?
I'd probably pass out first, and then I would be wanting to know. It would be the baby, not my daughter. I would be worried about the baby. I wouldn't be focusing on her. I'd be focusing on the baby. I'd want to see the baby. I'd be mad. I would be hysterical. I would be distraught.
Disappointed, anxious, grieving, upset. I mean, the whole plethora of emotions would come at you.
Oh,
and
yeah.
then I'd be like, "You have to separate me from my own child."
Right. That would make me extremely angry, and I would probably panic and say things I shouldn't say. But again, my focus would be on that baby, on that innocent baby.
And I'm a big passer outer too. Okay. We were at the hospital with my son and they were starting an IV and it looked like foam coming out, and I just hit the floor.
Yeah.
I was just down like a ton of bricks. And he had stomach virus. He was in there for several days. I mean, I was just down. Next thing you know, I'm in the next bed next to him.
Yeah, they're right.
Well, I had just had a hysterectomy, so they were like, "Oh God, we have a lot going on here." I mean, I felt bad for those nurses.
But did you hear how many times those nurses said that they checked on her? And every time they did, she denied needing any help. That's very, very important.
Thank you. Thank you. I'm so glad. It's like angels reading my mind today. We're catching all the same things. They asked over and over, and she said, "I'm just having trouble going to the bathroom." So she's telling them she's trying to pass a Big Mac turd, when the truth is she was giving birth and knew it.
Absolutely. There's no excuse for that. You can't tell me she didn't know the difference. I just don't buy it. My 6-year-old grandson knows what a baby is. I mean, give me a break.
Hell, OJ knows what a baby is.
Yeah. But they did check on her, and they did ask her multiple times if she needed help. And I think the fact that staff nurse, the guy's staff nurse, had to go and get people to open the door with the key says a lot, in my opinion, about their concern for her, not their negligence of her. I mean, that's a big deal in the hospital when you violate somebody like that. You have to do it if you think there's something, if they're going to harm themselves or there's something nefarious going on. Yeah, you have to do that. That's your duty. And the fact that they did try to get the keys and they did get the keys and, forced their way into the bathroom. And then she came out and walked right by them like just another day of constipation. I mean, that right there says a lot too.
They were about to break the door down. They had the key, but she came out like, oh, look, nothing happened. But they see blood everywhere. I believe the charge nurse when he said we assumed that she knew the gig was up and she was hurting herself. We weren't to think that she was delivering a baby alone and would put it in the trash can.
Right. And that makes sense. Here's a girl that found out she was pregnant. She either doesn't know or she's lying about it. Now she might be upset. What is she doing in the bathroom? That would make sense. They're not going to sit there and think, oh my God, she's having a baby in the bathroom.
Bruno thinks there's a cat around because he heard OJ going, rah,
Do you hear Bruno? Yeah, Bruno's not a fan of cats. I'm so sorry.
Oh, that's okay. Oh. Now OJ's over here thinking there's a dog around.
Yeah.
We got to get them together, Angel.
We do. Have a play date.
If you ripped something and blood just went, it was like once you see the photo, you'll see what I'm talking about. It's just.
So like you say, like rip, like something went like that?
Yeah, like when you rip something, or if you cut something and you go, like you swing your hand and blood just splatters.
Okay, so
that's how it looked.
Oh, so this was fresh to you?
Yes, this blood was fresh. You could even smell it.
We didn't know what this blood was from. We were
not to cross cases, but this has always been an argument of mine in the Idaho case with Dylan and Bethany, because she said, "Oh no, we could smell it. It was fresh blood." So I've always wondered in these cases when they're like, oh, they didn't know what was going on. How did you not smell the blood?
Yeah, you can smell blood, and it's a smell that you don't forget, and then your nose gets accustomed to smelling that. Yep. I don't understand that either.
OJ, stop it. Come on. He just jumped up here and he's trying to get after the computer because he thinks there's a dog in there. Come on. I just gave you props saying you know what a baby is, but you don't know that there's a dog in the computer?
We were a little concerned that maybe she had, known that we were going to figure it out and that she might have harmed herself or something in the restroom, so the doc wanted to go check her, but obviously that wasn't the case.
Unclear as to what had happened, other nursing staff care for Treviso, believing she had a miscarriage.
Oh, she came out of the restroom. There was a little trail of blood from the bathroom back to her room. We went to her room. I went to get her undressed. The doctor came in, explained to her that she had a miscarriage. Her and her mom had a back and forth about it.
The doctor said she had a miscarriage?
Yeah.
Okay.
She said it seems essentially like, I'm not sure the exact words. So it was a few months ago, but she said, it seems that you've suffered from a miscarriage, which didn't seem totally abnormal. It seemed awful miscarriages before they were very bloody.
Right.
And so.
Was she bloody?
Mm-hmm.
Like
and then
her legs?
Yeah, she had blood all down her legs, and then there was like blood in the bathroom everywhere. So.
Where exactly was the blood and how much?
It was a good amount. It was like on the floor.
Minutes later, cleaning staff arrived to wash up the bathroom.
I was called and to go clean the patient's bathroom in ER around, maybe 2 o'clock or so. I think it was the time. I'm not too sure. So when I went in there, it was a bloody massacre mess.
Could you describe it if possible?
Yeah, there was blood everywhere. There was blood on the floor, on the wall.
Do you remember which wall?
the one behind the toilet, and then the one on the side right here. You know, there's the one where the toilet sits, back of that.
Yeah.
And then on the side.
Where the call button is?
Yeah.
Okay.
And on the floor, everywhere.
After cleaning the entire bathroom twice, the cleaner grabbed the trash bag to toss it away. That's when she discovered the newborn baby.
When I went to go through the trash, I felt that when I picked up the trash and I looked in it, there was there was trash in it. But I knew that it didn't feel like when I picked it up, it was some weight. So I thought it was the trash bags, because we put the trash bags on the bottom.
Mm-hmm.
And so I started getting the trash out. And then when I did that, I seen that there was a baby in there. And that's when I freaked out, and I called Lori and HT, or the nurses up front, and because there was a baby in the trash. And the baby, when I looked at it, the baby was wrapped up like in a, like at the bottom of the trash can, and with trash on top of it, in a trash bag.
And so how did you see it, like as soon as you picked it up?
No, after I picked up the trash bag that was on top,
okay,
where they were throwing the trash at, when I picked that up to change it, that's when I noticed that there was, when I seen the baby.
You like describe the baby?
Yeah, he was about like that big. He had hair, and he was like purplish, but still not like pink. I don't know how to describe it. He was like, he wasn't bruised or nothing like that, and he was like purple, pink skin type color.
The cleaner then calls for a nurse who describes the disturbing moment the infant was discovered.
And then when I picked it up, that's when I noticed it even more, because all I saw was black and purple. But once we picked it up, like the bag suctioned to his face. And that's when I yelled for my charge nurse, which was HT.
Okay, this is really, really disturbing. So she doesn't know what she's getting into. She sees black and purple, and then she says, then I see it suctioned to his face. Well, it's only going to be suctioned to his face if he was trying to breathe. I'm no doctor.
That's right, Brooks. Mm-hmm. That's a very important statement. Mm-hmm.
If you put a Ziploc bag on a dead person, guess what? Nothing's going to happen. You put one on me, it's going to be suctioned to my face because I'm going to be breathing.
Mm-hmm.
This is huge. So when she said that, kiss my ass on the morphine, kiss my ass on the Zofran.
Exactly.
The fact that he was trying to breathe in that trash can is going to be it for that jury.
Absolutely. I think so.
Oh, that's disturbing.
And I told him, hey, she put her baby in the trash can. So I handed the baby to him, and he took off to the trauma room and opened up the bag. And then that's when we went and got Dr. Vasquez.
Police then hear from the nurse in charge, who says it was clear early on that the newborn was dead.
I go in the bathroom and she goes, something's in the trash can. I'm like, I looked in there, there's a clean liner. I'm like, what are you talking about? She goes, pick it up. I picked it, I could feel the weight. I knew then we had a serious problem. I just grabbed the trash can and went right across the hall into trauma 2. The liner was pulled out, but there was another trash bag in there in the bottom, but it was all it was rolled up. So I had to tear it apart. And then, of course, I saw the baby in there. So I pulled the baby out, got him on the bed, checked for signs of life. There was absolutely no life whatsoever. I immediately came out of there after I did that, went into the room where she was performing.
I have a question about hospital protocol, Angel, and maybe you can answer it, maybe you can't.
Okay.
So if there's no signs of life, would they administer CPR or not? Because that seems to be a big argument. People saying, well, the hospital didn't administer CPR. We really don't know if they did or didn't because we haven't seen all of the video. What we have is just what's been given to Law and Crime. We don't have the whole thing. That's going to be for the jury. So would they or would they not administer CPR if they know someone's dead?
If there's no signs of life, and you have no ability to determine for sure how many minutes have gone by since that baby had stopped breathing, then it would kind of be kind of cruel to resuscitate the baby. That would be the doctor's call. And I feel like this nurse would have initiated and started CPR if he felt like that there was a chance to save that baby. But sometimes, when somebody's already dead, you don't know how long they've been that way. So resuscitating them could be actually more harmful than helpful. You may resuscitate them and have a brain dead infant. Does that make sense?
Okay, so you're saying it could be more harmful than helpful because you could have a brain dead infant.
Well, you could also not have any response to the CPR. It depends on how many minutes that person has been without oxygen. You come up on a situation, the first thing you want to do is CPR, but that charge nurse, he must have seen that the baby was, maybe, I don't know, did he even say the baby was warm? I don't think he did. So if he saw no signs of life, the baby had obviously passed. Okay. What kind of damage did that baby undergo during that process? Sometimes it's too late to start the resuscitation.
Well, this sounds very simple, but when they pull someone out of the river, they don't put them on the bank and give them CPR. They already know they're dead.
Right.
Someone dies on the way from the hospital, they don't bring him into the ER and give them CPR. They already know they're dead.
And the baby was changing colors, which that change in color actually tells you that the baby has been without oxygen.
And this is very important too. Thank you, Crafty Chris. You are on your game today. Crafty Chris said also, this is a crime scene.
Yes, absolutely.
And that is something nurses and doctors are definitely trained in, because they know when the authorities get there, if they've tampered with anything, they're up shit creek without a paddle.
That's right. You have to leave everything like that and just leave it there till they get there.
Wow. This case is going to be the death of me, Angel.
Yeah, and people that work in healthcare, like I said, most of the time, they're there. Most people are there with a good heart. They go into this profession because they want to help people. They want to make a difference in people's lives. No, all doctors and nurses are not the same. But generally speaking, people have a desire to take care, to nurture, and for that charge nurse said, she didn't give me a chance. That right there was very heartbreaking for him, I'm sure.
He's still living with this. Think about it. He's going to be a big old ball baby on the stand because it hadn't sunk in yet. They're all running on adrenaline, in my opinion. And for him to say, she didn't even give me a chance to save the baby.
Yeah. Those are powerful words.
Performing the vaginal exam, and I immediately told her, you have to come out now. And she came out, and we went into trauma 2, and she reassessed the baby. At that time, between me and Chris and her, we determined, there was no reason for us to begin any life saving. The baby was completely gone.
Another nurse recalls the same moments.
And could you tell if the baby was alive or
they did not look alive?
It didn't look alive.
It looked. But also, I think the time had passed since she left the bathroom and it being in the bag. It was just.
How long do you think that was?
Maybe like 10 or 15 minutes. I just have a guess. I don't know. We brought the baby up. We called the doctor, obviously, out of the room from her exam, and we came in, kind of. Doc assessed the baby and basically determined it was not viable to completely work the baby and all that. So.
That nurse tells officers he believes Treviso knew she was pregnant and wanted to hide it from medical staff.
It seemed like we were being just deceived from the beginning, but that's just my take on it. It seemed like she was very manipulative with us. And it was at least what it seemed like to me. She didn't want you to discover, that she was pregnant, and she wore really baggy clothing. And she wouldn't sit still for you. I'm sure she was very uncomfortable too, but yeah, she wouldn't allow you to do it.
It seemed like she'd been trying to hide this pregnancy from her mother for some time.
Mm-hmm.
So if you know you're pregnant, you're not going to continue taking birth control doses. But if you're trying to hide it, you might start taking weight loss medications. That's just kind of what it seemed like in my head.
Other staff described the lengths Treviso allegedly went to keep her pregnancy and birth a secret.
The umbilical cord looked like an animal had tore it apart. Like,
Okay, I go back to the comments from the beginning of the show, from the last show, where one of our members said, and if you're not a member, please consider being one. We have members live. We have a lot of members comment. It's a lot of bang for your $2. But when I think about the comment from one of our members that said the umbilical cord is going to be the key. Now you listen to her. It looks like an animal went after it. That tells me she chewed it.
That's what I think.
You said that early on. Listen
Yep.
to this. It's very important. And I agree. I think the umbilical cord is going to be a lot of this.
an animal had tore it apart. Like, how, have you ever eaten string cheese? Like, when you twist it, that's how the bottom of the umbilical cord looked. And I just remember it caught my eye, and I was like, God, I was like, this chick really ripped this thing apart.
After this, medical staff called the police and alert Treviso about their discovery.
I'm sorry about this, but in terms of delivering a baby and it looked like you tried to hide it, you do have to have the police involved.
And nothing was crying. It came out with nothing.
And then I went in there to talk to the patient and asked her why was the baby in the trash can.
And what did she say?
She said that it just came out of her and she didn't know what to do.
And I said, did your baby take at least one breath when it first happened? Or did it take at least one breath, or was it not breathing? And then she kind of looked at me in the face and the eyes, and she was like, well, can I tell you? And I said, tell me what? And she said, so I've been having this bad abdominal pain, she said, and we came here to the ER, and when they brought me back here to this room, I felt like I needed to go poop. She said, and I asked if I could go to the bathroom. She said, and so when they said, yeah, that I could go to the bathroom, she said, when I sat on the toilet, she said, it just all fell out. And she said, but when I had it in my arms, it wasn't breathing, it wasn't moving. And so, of course, you want to be very, very judgmental at that time, and you have to bite your tongue sometimes. But, my first reaction was like, I wanted to say, hey, well, then why wouldn't you call us for help?
This is also very significant, as Jay Koff would say. Then why wouldn't you call us for help? Excuse me, I had to sneeze. Then why wouldn't you call us for help? She's like, at that time, you want to be very judgmental. And you're like, why wouldn't you call us for help? My third son, my ex-husband cut the cord. He didn't use his teeth, by the way. And I remember watching, and it wasn't easy to do. And this was with hospital, I guess I'm going to say shears. It's some pretty strong meat, okay? That's a lot of adrenaline. That's a lot of wanting to cover up. Do you agree, Angel?
God, yes. I cannot imagine. Ugh.
This is like some Hannibal Lecter shit.
Yes, it is.
Good Lord.
But I didn't. She said, so he wasn't moving, he wasn't breathing. So I just placed him in there.
Nurses who spoke with Treviso after the baby was discovered say she never asked about him. Instead, they say she was more concerned that she would get in trouble with her mother.
Did they have any comments?
Not one.
Really?
I was really surprised. Not one person asked me about the baby, if it was alive, if it was dead, if it was a boy, if it was a girl. No one asked me anything. Not even, she didn't even ask. No, she didn't ask. The only thing she started doing was crying and started talking about she didn't know what to do. Not one. I've never seen I've delivered multiple babies and I've seen multiple miscarriages and I've never seen a reaction like that. And I don't even know what to say about that. I've never seen anything like it in my life.
How would you describe the reaction?
I think there was no emotion except for herself. And she really wasn't even crying tears. She was just, and the only thing she was upset about was that I think she was going to be in trouble with her mother.
She didn't say anything about what had happened. She was just essentially worried that she was just going to get in trouble.
So that's what I mean. Were those the questions she was asking?
Like what's going to happen to me? Like that kind of thing.
Did she ever ask about the baby?
No.
Not once.
She essentially was scared. She was worried that she was going to get in trouble. She did have the back and forth with her mother that was just about like, they had said, oh, the mom was upset because she had had sex and hadn't told her. So they were going back and forth on that. And then she was just denying it, which was a little wasn't really deniable at that point in time.
Right.
So the patient was denying having sex at this point to her mom.
Yeah, she was trying to state that she was still a virgin.
After she came in from the bathroom.
Others believe Treviso knew she was up to no good.
She definitely knew what she was doing and what was doing was wrong because of the way she was talking to me, just stating, I didn't realize I was pregnant and, but I'm taking birth control, so, she was panicked, but, I didn't see her being in a state of mind where she did not know what she was doing.
Multiple hospital staff members say the incident is not one they will soon forget.
When there's like one or two things in the wastebasket, I usually pick it up and take it out, but I didn't that night. And then, I've been kicking myself on this because I feel like, if I would have just taken it out, I would have seen it.
She's blaming herself for ignoring the trash.
Yeah, so she's a nurse that, which is common, that they work as a team. She helps out the housekeeper. She didn't do it this one night for whatever reason. And now she feels like she's responsible for that baby not being alive. How sad is that?
It's absolutely horrible what Alexi has put all of these people through for her selfish actions. And Mr. Boyfriend, who probably started cheating on her when her belly was getting bigger. He knew it wasn't from Big Macs. He might have pressured her to get rid of the baby. We don't know.
Yeah, that's true.
Don't think Mr. Boyfriend isn't going to be called to testify. He might not be cooperating now, but a subpoena is going to get his skinny ass in the chair.
Yes, I can't wait to hear what he has to say.
Because they're going to ask the tough questions. Were you still having sexual relations? Huh. Of course they were.
Right.
What did you think about her stomach protruding out of, what did you think? What did you think was going on? How many nights a week did she sleep at your house? If I know these things, Devin will know these things. How about positivity before we shut down?
Sounds wonderful.
Because we know this is a very hard case to take. We know it.
Yes, ma'am.
Positivity, final note. These triplets were born and they all are exhibiting their own personalities. It is absolutely adorable. Absolutely adorable. Look at this. Is that not adorable?
Oh my goodness. I love how the one in the middle was just laying there and not squalling at all until the other two kept on and he was finally like, okay, guys, I'm doing it too. I love it.
Typical middle child. He's already got his fists up.
That's right.
Lindsay said he's like, chill, y'all. That's how my middle son always has been. Would you guys calm down?
Absolutely.
Absolutely adorable. And you know what, Alexi, I really wish they would just give her a tubal and fix Mr. Boyfriend too. Because you can't tell me, since he was not there to support her through this pregnancy, that he, with his new girlfriend, and he wasn't safe with Alexi, don't think he's going to be safe with the next one. His mom seemed like a helicopter mom. She was letting Alexi stay over at night. She knew they weren't doing Netflix and chill. This is dangerous.
Oh, yeah. It's very disheartening. And, you know, when people start doing stuff like this, self to where we can't get any health care because the number of doctors are going down, 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 and nurses, then, you know, we're going to be in trouble.
Well, and I mean, I love that comment by T Wood saying, well, hell, this is why we can't afford health care. It's not about the cost of medicine. It's not about the cost of the doctors. It's about these lawsuits because they have to defend this. They have to defend this. Let's get to the word of the day, and then I'm going to start shutting it down.
What's today's secret word?
Ooh, interesting question. Let's go and ask Cocky.
Finger licking good. I've never seen an attorney that threw so much shit at the wall. Thank you, Christina, for suggesting this, because here is my version of Alexi's attorney.
Well, as tasty and delicious as it ever was. I'm Colonel Sanders, and I'm back, America. I'm back, America. It's still finger licking good.
Damn right. Oh, DT Driver, he's probably not going to want to come home after working his ass off all week to a bucket of chicken, but for some reason I'm cooking it now.
Gonna have some fried chicken, Kentucky Fried Chicken tonight.
Oh, I doubt he's going to want that. He's going to say he's more of a church's chicken dude.
I gotcha.
But Angel, I want to say thank you so much for coming up and walking us through this. You are a true friend. You're a wonderful supporter of the channel. Back to more important, you're a true friend. And the way that you take your knowledge and explain to us like what's really going on behind the scenes from your perspective, in a case that infuriates us all. Let's have a round of applause for my good friend Angel P. Thank you
Thanks so much, Brooks. I really appreciate it. And I'm not anything special. I'm just doing what any reasonable nurse would do. And everything I've ever done or do, to God be the glory. I love you guys so much. And I want all you guys to take care and come back and see us. Thanks,
Come back
Brooke.
and see us. Love you, girlfriend. Oh, I did not mean to cut her off. She was saying love you. Thank you, Extra AF, for the super sticker. Thank you for the gifted memberships today. You guys are too kind. It humbles me the way that, you guys come in and keep this channel afloat. You are the life rafts for this channel, not me, and damn sure not OJ. OJ heard me say Church's Chicken. He got into the Church's Chicken the last time DT Driver got some. He shit like a goose. Damn, I've never changed so much litter. Anyway, that's totally off topic. I will see you guys, whether I'll see you in Discord, one of the Facebook groups, possibly going to have a live this weekend if I get myself together. If not, we have Motabolism Monday on Monday. You know who that's about. Summer Wells, the Summer Wells case. It's going to be a little different Metabolism Monday, but hopefully you enjoy it as much as I enjoy you, because you are the best chat and best community on the tube.